way.
Technically, yeah.
Joan?
Oh, I'm here? Me. Okay.
Kimberly?
Anybody else has a
I'm good. No.
Responding to issues that have come up.
Your question was there.
Thank you so much.
Let's just plant you over here as we walk through the range.
Folks, could you have a seat? I'm not hearing it. Folks, could you please have a seat? We're going to get going.
Everybody get a seat.
We did find the key to the air conditioning, so we'll get marginally cooler. But we have a full house, so we humans throw off heat.
So we have a certain amount of control.
Thank you all for coming.
Thank you.
Does everybody have a chair who wants to have a chair? Raise your hand if you want a chair.
Oh, yeah.
Okay.
But you're up almost immediately. Hold on. Okay.
My name's Earl.
Honor and peace.
We're going to get going here, and we're live on Facebook.
So, good evening, everyone. I'm Gail Brewer, Manhattan Borough President. I have a name. And I really want to welcome all of you to tonight's 9/11 Town Hall for the downtown community, but for anyone who's interested. It's co-sponsored with the 9/11 Environmental Action, and I want to thank them. So I think you know we're here to explain two programs which were established by the James Agroda 9/11 Health and Compensation Act. One, the World Trade Center Health Program, and two, the September 11th Victims Compensation Fund. And I know that we all know that instrumental were, of course, many people in this room, but also Congresswoman Maloney and Nadler and Congressman Peter King, along with our Senators Schumer and Gillibrand. And there were many others, and certainly John Field and Ben know better than I. But these two federal programs assist the responders who worked in the rescue and recovery efforts at Ground Zero, and all of those who lived, worked, or went to school in Lower Manhattan in the months after the attacks. Despite being told by the federal government, we all know that the air was safe to breathe, we all know that it was not. It was clear that responders on the pile who were closest to the toxin-filled air were getting sick. But it was apparent that similar issues were affecting area workers, students, and residents, and recently many of the students have come forward. All these folks merely did what they were told was safe, returned to their homes, their schools, offices, and their everyday lives. Tonight, and we really appreciate the panelists who are here, will explain what these two programs offer to survivors, those who make up this resilient community, and I'm really proud to be the borough president for this resilient community. The World Trade Center's health program, Survivor Program, provides specialized health care at no out-of-pocket cost for 9/11 related health conditions. It's a critical lifeline for many people. I want to thank particularly, to explain the program, Dr. Joan Riedman, right there in the black sweater. And she is a professor of medicine and environmental medicine at New York University's Bellevue Hospital. She has served as the medical director of NYU Bellevue Asthma Center, and in 2001, she led the first research study of the respiratory health impacts of 9/11 on Lower Manhattan residents. And she helped establish the WTC Health Impacts Clinic at Bellevue, a pilot program to treat 9/11 illnesses among survivors. And her official title is Medical Director of the World Trade Center Environmental Health Center, also known as the WTC Survivor Program. And I want to thank her very much for making the time tonight. The September 11th, thank you very much, Doctor. The September 11th Victim Compensation Fund, it's called the VCF for short, is a separate program run by the United States Department of Justice which provides survivors and responders with compensation for pain, suffering, and economic losses due to 9/11 related physical illnesses. It also provides compensation to the families of those who have died from 9/11 illnesses, and I should tell you that there are people who work in this building, 9/11, who have died since 9/11, people who worked with me. We're here to discuss the VCS requirements is Rupa Bhattacharya. She is the special master of the Victim Compensation Fund, and she has come all the way from Washington to be with you tonight. She is an experienced attorney and public servant with the U.S. Department of Justice, and she was chosen to head the fund in 2016. Prior to that, she served at the Justice Department's Constitutional and Specialized Torts Branch, managing the Vaccine Insurance Compensation Program and the Radiation Exposure Compensation Act program. Thank you very much for joining us in the beautiful black, white, and red shirt, all the way from Washington, D.C. And here to moderate our session is Kimberly Flynn, the director of the 9/11 Environmental Action. It's an extraordinary organization founded in the months after the attacks to call attention to the environmental health risks of the disaster. Key to their mission is to ensure that those who were affected physically or emotionally get the health care they need. I want to make a special shout out to Barbara Ricci of 9/11, Terry Miles of the Survivors Program, and all the staff at the Department of Justice who are making tonight's event and all of this great turnout a success. We want to make sure that everyone who is eligible has the information they need to understand the benefits of the programs. We are webcasting this session on Facebook Live, and we will have a recording of the session posted afterwards on the website of the Manhattan Borough President, manhattanbp.nyc.gov. So first, we will have the woman who has come all the way from Washington, D.C., Ms. Bhattacharya, to explain the VCF, and then Dr. Friedman will present the Survivors Program, and Kimberly will select and pose the questions that the audience have written on the index cards. Thank you all very much for joining us tonight, and we look forward to your participation in the future. So whomever would like to go first, maybe I did it wrong, go right ahead. Thank you very much.
So we actually decided we would switch, and we would start with sort of a background of the medical program. And I'm Dr. Reibman, as you heard, and I've been involved with this program since the weeks after 2001. And so thank you very much for inviting me here. It's really a pleasure to see such a turnout. What we thought we would do today is really give you basic background of the programs and how they're interfacing with each other, and really tell you a little bit of a story of how these programs have developed over the years and how that's changing and why that's important for you to know. So let me start, if I can, figure this out. So what I'd like to do today is just give you a little bit of a history of the World Trade Center health programs, a little overview of the programs, really focusing more on the Survivor Program, because that's the one I really know the best, which is really the World Trade Center Environmental Health Center, and then talk to you about how we're now interacting with the VCF, which is, I think, the interest of the evening. If I can, let's see. Okay. So I want to, there's a lot of names that get thrown out, and there's a lot of abbreviations that get thrown out, but the first thing I want to start with is the understanding of who were the populations at risk. And that's always really a key thing when we're talking about an environmental insult. And with the World Trade Center events, we understood that there were actually a number of populations at risk. And certainly there were the firefighters who you all know came to the rescue of so many. There were the responders who also came and helped in on 9/11, as well as for many, 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 many days, weeks, and months afterwards. And of course, there were the community members, the individuals who lived downtown, who worked downtown, who went to school, who had families, all of those individuals. And the development of the health programs for each of these groups of populations at risk really varied over time for a number of reasons, many of which you know. But some of them were because a lot of it had to do with the fact that certain programs already had pre-existing health programs. So the fire department, for example, had a pre-existing health program. So it was not easy, but easier for them to start to develop a program to respond to their firefighters and EMS workers who'd been exposed. This program also became unbelievably important because it was one of the only programs that had information, health information, before the event and after the event. And so it has become really the lead program in terms of helping to identify adverse health effects in many of our population. The responders also had to fight very hard for their health program. They were supported by many of the politicians around, as well as the unions, and they had also some pre-existing programs that helped. Again, it was not easy for them. It was very hard, and they had to really fight a huge battle in order to get medical programs. And the community members were really much more diversified and didn't really have a pre-existing program. And there are many, many community members in this audience who really fought very hard for the programs that exist today. So we now have really three groups that we think about that have screening programs. The fire department, I can't see these slides, so that's a little bit, the fire department, the responders, and the community members who are called the survivors. And they're called survivors because of political names that were given as we were fighting for the legal and federal support for these bills. So I like to call everyone community members, but we are formally called survivors. And the first programs that came about were really eventually federally funded screening programs. These were for the fire department and the responders. Subsequently, this is not working. It may work. Oh, okay. Subsequently, there was some philanthropic funding given to some of the firefighter and responder groups for treatment of illnesses. So the initial programs were screening. Is there an adverse health effect in this population? Subsequently, philanthropy funded treatment programs, and in fact, the community members at that point also started to get some, actually we started with a self-funded program, so we began our own program without any outside funding. And then there was philanthropic funding through the Red Cross, really for the first major treatment programs for both the responders and the survivors. In the survivor group, this program eventually was funded by the city, whereas in the responder group, the funding was taken over by the federal government. But the survivors or the community members did not get federal government funding. Initially, we had to get funding through the city, and then eventually we got federal funding. And then after many of the efforts of many of the people in this audience, under the James Zadroga Health and Compensation Act of 2010, funding was made available for screening and treatment for these populations, although the funding was a little bit different. Oops. I'm sorry, this is not... Oh, oops. Where did I go here? Let me go back. This is a little delayed, so Can you do me a favor? Is that possible to make it go back? Yeah, that's it. So the initial funding for the responders and firefighters was really to do screening, treatment, and monitoring. So there's differences in terms of screening. Screening means you take individuals regardless of how they feel, you do an assessment and you identify who's healthy and who's not healthy. Monitoring means you repeat that again at various intervals, and treatment means you treat what you can find that is needs treatment. So we began really as a treatment and monitoring program. We were never a screening program. We were never given the funding to just screen populations. I went I'll come back. To screen populations, we began as a treatment and a monitoring program. And there's another very important difference under the Zadroga Act, which is that the responder program is they're the primary payer. Whereas for the survivor program, we are the secondary payer. That's a very, very, very important thing to understand. What that means is that if someone comes to the program and requires treatment, we will first bill your insurance, and any difference that's there will then be covered by the World Trade Center program. So we are the secondary payer. And for those of you who knew little about health insurance like me, this was a concept that was a little bit difficult to understand, but it means we will first bill primary insurance, and what's left over will then get covered by the World Trade Center program. Somehow I'm going in the wrong direction. Could you go back and back and back and back? There. This is what I wanted to say, because of terminology. It's very, very important. Under the James Zadroga Act, there were several programs that were initiated. One was an epidemiologic program, and that is through the New York City Department of Health and Mental Hygiene, and that's called the New York City Department of Health and Mental Hygiene World Trade Center Health Registry. Now, that's a very important thing to understand. That's a registry. One had to enroll in that program very early on. You had to have been exposed to the World Trade Center dust within a defined period of time. Enrollment for that program is closed, but they keep recalling and reassessing how everybody is doing in what they call waves. And so you might get emails or mails, or somebody might visit you to see how you're doing, to redo questionnaires. That is an epidemiologic program. It's not a treatment program, but they will work with us as well. The World Trade Center health programs are the ones that do screening and treatment, and those are called centers of excellence, and those are the ones that focus on the firefighters, the responders, and the survivors. The enrollment for those programs is open. You can still come into those programs, so they're not closed. The degree of exposure that we ask for differs from the registry, and those are clinical programs. And then there's a Victims' Compensation Fund, which you'll hear much more about. So 3 focuses: epidemiological, health screening and treatment, and a Victims' Compensation Fund. Okay, let's see if I can. Yeah. So we talked about the differences in the treatment of the health programs, the World Trade Center health programs, which service the fire department, the responders. There's also a national program as well, and then the community program in New York City. Could you go back? Thank you. So what is the World Trade Center Environmental Health Center, or the WTC-EHC? This is a treatment and monitoring program created by the National Institute of Occupational Safety and Health under the Centers for Disease Control. And we are for eligible survivors, and we treat covered medical and mental health conditions, which are called certified or certifiable conditions. If you could do the next, I got it. I think. I'm sorry. It's just because is that the next one? Okay. So who is an eligible survivor? Who can come into the World Trade Center Environmental Health Center? There are now requirements determined by the federal government. You can see them more clearly if you search the site, CDC World Trade Center site. But it's a person who is present in the New York City disaster area in the dust or dust clouds on September 11th, someone who worked, lived, or attended school or childcare or adult daycare in the New York City disaster area. There are some defined periods of time. Or someone who worked as a cleanup worker or performed maintenance work also in the disaster area. So there are definitions about who can be considered a survivor. Could you do the next one so I don't? Thank you. In addition, there are more possibilities. You could have received a grant from the Lower Manhattan Development Corporation Residential Grant Program, or your place of employment could have been anywhere within a certain geographic area within September 11th to May 31st, 2003. If I state something wrong, please look up so you can be exact on this. Can you do the next slide, please? This is very important. This is the eligibility geographic boundaries for the survivor population to go into the World Trade Center Environmental Health Center, so the clinical center. And I'm going to come back to this because this is a wider boundary than you'll see for the VCF. And this is, again, because historically we started with a very wide boundary when we ended up under I can't even say it anymore. The Zadroga Act, it got smaller, and with the VCF, it got changed. So it's very important to know these boundaries. You can find them again on the website. Can I have the next slide, please? Thank you. So what gets treated? What is a certifiable condition? So in the WTC EHC, once you have gone through the government screening and gotten through us, and you are seen by us, we have to assess whether you have a certifiable condition. So we have to first see, do you have a defined exposure? And we will take a very extensive history from you. We have to then assess whether you have a certifiable condition, which means that the condition, this is a legal term really, is substantially likely to have been caused, aggravated, or contributed to by the exposure. And there are implications for all of this, and it's defined by the exposure, the timing of onset of your symptoms, and the type of injury. So there are different criteria for different conditions, and we will do a very extensive interview, questionnaires, etc., to try to get at this to decide whether you have a certifiable condition. Next slide, please. Thank you. So what are certifiable World Trade Center related conditions or covered conditions? Well, they have changed over the years. So in fact, only recently was acute traumatic injury included. For many years, this was not included. Thank you so much. So that is something that's a musculoskeletal trauma or burn or eye injury that occurred within, I forgot the words there, within a certain period. There are aerodigestive disorders, chronic rhinosinusitis, that is chronic sinus illnesses or nasal illnesses, asthma. COPD is a newer condition that was added more recently, interstitial lung disease, severe acid reflux, depending on the time and associations. Could you do the next slide? Thank you. Certainly there are mental health conditions, and these include post-traumatic stress, as well as depression, panic disorder, substance abuse. I'm not giving them all to you here. Next slide, please. Cancers. So cancers were added more recently. And cancers include a whole slew of cancers that include those involving blood and lymphoid tissue, any childhood cancer, breast cancers of a certain type, ovarian cancers, digestive symptoms, skin, soft tissue, mesothelial, thyroid, and rare cancers. But it depends, again, on the cancer. And in order to get it certified, we need you to bring in documentation of the cancer, including pathology reports or any biopsy reports you've had, because we have to give those to the federal government to get them approved. Next slide, please. Where is the World Trade Center Environmental Health Center? So the centers in New York are there's three of us. There's Bellevue, which is the biggest one on 27th Street and First Avenue. There's Gouverneur, which is on Madison Street, and also Elmhurst Hospital. And so one can go to either of those. They're not all staffed the same. Bellevue has the most staff, and some of them have pulmonologists, some of them have internists, some of them have also gastrointestinal specialists. We try to get you to the right place that you need to be at. We do not take care of your cancer. Can I have the next slide, please? We will do many of your other illnesses treated by an interdisciplinary group that includes pulmonary specialists, mental health specialists, GI specialists. We will recall you for monitoring visits. We are a little behind in that, I have to admit, because we've been overwhelmed, but we try to get people in. Next slide, please. We will give you access to mental health treatment with psychologists, psychiatrists, social workers. We provide pharmacy coverage, but again, this is for certified conditions, not for every one of your pharmacy needs, but for certified conditions, and also coverage of durable items for certified conditions. But again, we will do your insurance first and then anything that is needed. Next slide, please. we do not take care of your cancer. We document this and certify you for it, but we do not want to interrupt whatever cancer care is going on. We will refer you to a case management for support and coordination of your care. We do have approved programs, which are most of the programs in New York City that are good programs. We will approve cancer treatment for approved standard of care. This is usually through what's called the NCCN guidelines. So, and there's a lot of give and take with case management with our own personnel who are very, very skilled in understanding what are the cancer issues so that we can work with you to make sure that we can approve the most appropriate treatment for you. But we do not do that care ourselves. Next slide, please. Thank you. So as I said, coverage for treatment and prescriptions are provided only for certified World Trade Center related or associated conditions. Each condition must be approved, and we have to certify them. Treatment is covered only for World Trade Center approved providers, so not all providers. Again, with cancers, it's a much wider number of providers than for non-cancer conditions, and the program is a secondary payer with insurance for medical care and prescriptions billed first. Next slide, please. Thank you. Now, these healthcare programs were developed initially separate from the VCF, sort of a separation of church and state, which I had in there. But we are separate, or we were separate, because the Survivor is a treatment program and monitoring program, neither a general screening program nor a pass-through program. In other words, we were treating everybody. However, those rules were modified recently, and they were modified so that, in fact, VCF eligibility required that the World Trade Center Health Program, either the Survivor Program or the Responder Program, certify the condition for treatment of an eligible physical injury or condition that's determined to be a result of the attacks or debris removal. So that was really a huge change for us, because that meant now that anybody applying for VCF now had to come into our program. Could you do the next slide, please? And now, instead of being separate, we really have to work together and be partners, but understand that there are differences in the program. Next slide, please. So one of the main differences, as I told you about, is who's included. And you can see this comes from one of the law firms, but it's very useful. The area in light pink are geographic boundaries for the World Trade Center treatment programs. The area in dark red are the boundaries for the VCF. So the boundaries are not the same. You could be in our program but not be eligible for the VCF, although you could be in the VCF program and be eligible for our program. So that's very important. Next slide, please. Thank you. The changes in the requirement for the VCF means that many, many, many more individuals are applying to the Survivor program. So this has resulted in a very, very long wait list. We understand that. It's overwhelmed our capacity, it's overwhelmed our staff, it's caused huge delays in scheduling new patients who want to come in, as well as people who are already undergoing treatment. So we're all getting sort of thrown around as we are trying to understand how to accommodate these new requirements. And many of you, we understand, are getting enormously frustrated. We know that, and we understand that. The next slide, please. But there's important things to understand that you're going to hear over and over again, which is that you do not need certification from the health program to register with the VCF. So you register no matter what has happened in your correspondence with the health program. The health program will prioritize appointments for patients who need medical treatment over those seeking certifications for VCF claims, because we are a treatment program. We want to get everybody in, but we clearly have to prioritize those who are the most sick first. There may be a delay for those seeking certification to support a VCF, but as you're going to hear over and over, this delay will not impact your claim's timeliness, as that's based on the date you register. So registration is what's key. The amount of non-economic loss awarded to anybody is not based on the number of conditions certified by the World Trade Center Health Program. So many patients will say, you didn't certify me for my rhinitis, you certified me only for my sinusitis. It doesn't matter. Those are your rhinosinusitis complaints. complaints. It's varied by the type, severity, and the impact on your life. So the number of conditions is not the important thing. Next slide, please. Thank you. So I'm going to really stop here, except to say that we are working with the government, working with the VCF, working with everybody to expand the program to increase capacity in partnership with the government. And we ask for your patience. We understand that there are major issues that we are all trying to deal with. And I'm going to stop there. Thank you very much.
And now we're honored to have Rupa Bhattacharya, who's come all the way from Washington, D.C. Thank you very much.
Was there a clicker? I left it there, but I left it here. Oh, here it is. I see. Okay. It doesn't work so well. Okay. Hi, everyone. I am Rupa Bhattacharya. I am the Special Master for the September 11th Victim Compensation Fund. Thank you very much for having me here today, and thank you to President Brewer and 9/11 Environmental Action for sponsoring this event. We're very, very happy to speak to you, and we know that there are a lot of questions, and so we're hoping that some of this will answer some of those questions for you. The most important two things I'm going to tell you today are on this very first slide. The first is our website, which is at www.vcf.gov. This presentation is on the website, along with a lot of other information about the VCF. And you can that is also the place where you go to register and file your claim. So make a note of the website. The second thing is that telephone number, 1-855-885-1555. That is the number for our helpline. We have a very dedicated helpline staff that is there to help you answer questions, both specific and general. So particularly if you have already filed a claim and have a specific question about it, or have a question about how to file a claim, please reach out to the helpline. They are your best resource for information about those things. I am not going to go through everything in these slides. It's actually a relatively long presentation, but I'm going to try to hit the highlights. So forgive me if I skip some slides. As I said, the slides are on the website if you want to go back and refer to them later. So I want to start. No. Okay. So unfortunately, because I'm going to skip slides, here we go. Okay. So what is the VCF? So the VCF is a compensation program that is federally funded and that provides compensations for physical health conditions suffered by people who lived, worked, passed through, responded to, or were part of the tragedies of September 11th, 2001. It is a comprehensive program. It covers both responders and survivors, and we do not distinguish in our program between responders and survivors. The same eligibility criteria apply to both sets of populations, and we evaluate the claims in the same way, and I'm going to talk a little bit about both of those things. It is administered by the Justice Department, and specifically by me. The VCF was originally established in 2001 as an effort to bring financial relief to those who were devastated immediately following the attacks. Next slide, please. Oh, there it goes. It was originally established in 2001 to bring financial relief to those most devastated by the attacks. That is the program that was administered by Special Master Ken Feinberg. It closed in 2004, and so that program is complete, and no one can apply for what we call VCF 1. VCF 2 was created in January of 2011 as a result of advocacy by many of the people in this room, because it became very, very clear that the health effects associated with exposure to the World Trade Center were not ending. And in fact, they were only just beginning for many people. And so the new Zadroga Act reopened the VCF, which included expanded eligibility criteria and new deadlines and a funding cap that has since been increased. In December of 2015, the Zerdruga Act was reauthorized, which increased our total funding. So we now have a total funding pot of about $7.375 billion. Less than half of that has been awarded to date. So we still have plenty of funding available in our program. The eligibility requirements remain the same, but some of the policies and the procedures that apply have changed, and we'll go through a little bit of that today. Under the current law, the VCF is slated to close on December 18th, 2020. So anyone can register and file a claim until December 18th, 2020, subject to our eligibility requirements. And so we will talk about those. There we go, eligibility. So there are essentially 4 requirements in order to be eligible for the VCF, and then there's a couple of little extra things that apply to some people. The first is that you have to timely register a claim within an applicable deadline. Now, you're going to hear a lot of terms thrown around. The World Trade Center Health Program has enrollment, and then they have certification. We also have a 2-phase process. We have registration, and then we have claim submission. Registration is easy. It's name, rank, and serial number, birth date, social security number, address, not very much, some biographical information. You do not have to be sick. You do not have to be certified. All it does is save your place in line. You do not have to promise to file a claim later. It just saves your place in line. If you haven't registered yet, go register. It's the best thing that you can do to ensure that should something happen, you have the ability to file a claim. You can register on the website. We will also take registrations over the phone if you call the helpline. And we'll talk a little bit about the registration deadlines. The second thing is World Trade Center Health Program certification. As Dr. Ryman talked about, we did make a recent change in that we are now requiring World Trade Center Health Program certifications. Why did we do that? So we did it for 2 reasons. The first reason is because as we sort of progressed through the program, it became very clear to us that in the long term, our claim process would move a lot faster if we relied on certifications from the health program. Why? Because the doctors that you go to outside of the health program are not trained, do not have the capacity to evaluate whether or not your condition is related to your 9/11 exposure. The doctors who work through the World Trade Center Health Program are trained in that, and that's our legal requirement, and they can meet it much more easily than your private physicians can. And so that was our primary reason for doing it. We understand it's caused a bit of a backlog in the short term, but we are hoping that in the long term, it will in fact speed up the processing of these claims. The second reason for doing it is that we had a number of conversations with the health program about this, and they were of the view, and we were of the view, that having more people enrolled in the health program creates a larger research base for people to try to understand what happened as a result of this incredibly tragic event. And so we thought that by encouraging people to enroll in the health program, we could also help underscore that research, which is so critical to understanding which conditions are applicable, to trying to develop treatment options, to making sure resources remain available, and to prepare should we ever be in a position where we have to face an event like this again. And so those were the reasons why we made the change. I understand it's caused some problems in the short term, but like I said, I do hope that in the long term it will actually speed things up. The third eligibility criteria for a program is presence. You have to demonstrate that you were present in what we call the New York exposure zone within our time period, which is shorter than the health program's time period. Our program covers September 11th, 2001 to May 30th, 2002. The health program's exposure period runs into July. So that's one of the big differences between the 2 programs. The fourth big criteria is that if you filed a lawsuit arising from your World Trade Center Health Program, arising from your New York City exposure, from your 9/11 exposure, and the conditions that you've got as a result of that, you have to have timely settled or dismissed that lawsuit. Those requirements are very specific depending on when you filed and what you filed for, and so we would urge people, if you're in that situation, to please look at the information on our website, and if you're represented, talk to your lawyers. So I want to focus on the three big ones, which is timeliness, the certified condition, which we already talked a little bit about, and presence. For timely registration, this is very individualized, and we have a lot of information on the website that explains exactly how this works. But in general, under our statute, the law requires that you register within 2 years of when you knew or reasonably should have known, one, that you suffer a physical harm as a result of 9/11, and two, that you are eligible to file a claim. One thing I should note, this is another big difference between our program and the World Trade Center Health Program. The VCF, by statute, is barred from compensating for mental health conditions. We only cover physical health conditions. Mental health conditions are treated by the World Trade Center Health Program, but they are not compensable in our program. What does that mean? All that legal verbiage, knew or should have known, blah, blah, blah. So how we have interpreted that is to mean your registration deadline will be 2 years from the date on which a government entity tells you that your physical health condition is 9/11 related. So what does that mean? It means 2 years from the date you were certified, because the World Trade Center Health Program is a governmental entity. It's funded by the federal government. It means 2 years from the date on which the FDNY, the NYPD, NYCERS, NYSLERS, or workers' comp found you to be disabled as a result of your World Trade Center-related injury. And it's the earlier of the two of those dates. So for those of you who are not yet in the program, in the World Trade Center Health Program, and don't have a disability determination from one of the city employers, once you are certified, you still have 2 years to come into our program. It will run from 2 years from the date of certification. For VCF purposes, our policy is that if any of your conditions is timely registered, all of your conditions may be considered for compensation. So if you were certified for asthma back in 2011 and you didn't register with the VCF and your time ran on your asthma claim, and you are now coming down with a new condition, and we are seeing this unfortunately quite a lot with the cancer claimants, you will have 2 years from the date of your cancer certification to register with the VCF, and we will consider all of your conditions when we calculate your compensation. So it's the last certified condition that triggers your registration period. Registration, as I said before, is the very first step in our process. It is easy, it requires nothing, and you don't have to be certified to do it. So although the registration period runs from certification, you can register before you're certified, you can register before you're sick. So we do urge people to register as soon as possible. All it does is reserve your right to file your claim. Certified conditions. So you must have an eligible physical injury or condition that is determined to be the results of the attacks or of debris removal. As I said, we rely on the certifications by the World Trade Center Health Program. We do work very, very closely together. We exchange information with the health program. You don't have to provide us any information with respect to your certified conditions. When you file with the program, one of the pieces of paper that you will file when you submit your claim, so this is step 2, registration, then submission. One of the pieces of paper that you will file when you submit your claim is an authorization for us to go get information from the health program, and we will get information from them. I should note, we do not get medical records from the health program. Medical records are not necessary to process eligibility on your claim. We may want them when we look at compensation, and we'll talk a little bit more about that later. But all we need for purposes of eligibility is a confirmation from the health program that you are certified, and we will get that directly from the health program. So the third criteria I wanted to talk about was presence. So you must have been present at the crash site on the routes of debris removal or at any location within what we call our New York City exposure zone at any point from September 11th, 2001 through May 30th, 2002. As Joan showed you, our zone is smaller than the World Trade Center Health Program zone. It is only Manhattan. It does not cover any part of Brooklyn, and it is south of Canal Street. The World Trade Center Health Program goes all the way to Houston. Ours is south of Canal Street. We do require that claimants file proof of presence with the program. As a general rule, we require 2 proofs of presence. We take all sorts of things. There is a full list on the website. There's some examples here. They can include employer verifications that you worked in the area, sworn affidavits from coworkers or friends that knew that you were in the area at the time, injury reports that were filed with workers' comp or with private insurance companies that demonstrate that you were in the area, medical records that reflect that you were present at the time, and for residents, lease, mortgage documents, utility documents, and again, affidavits that demonstrate that you were in fact at the residence in that time. There are a number of employers that provide information directly to the VCF that help support presence. The FDNY does, so does the NYPD. And there are some private employers that do as well. There are full lists of these in the information that's related in our website. If you have any questions about that, you can call our helpline and they will let you know whether or not you need to file something specifically or whether or not we will be able to get information from one of our established relationships with a third-party employer. If your eligibility is denied for presence, if we don't think your presence information is sufficient, we have a very robust appeals process. Our appeals process is non-adversarial. They're held here in New York, although they can be scheduled by phone. They can be held in Washington. We have a group of experienced hearing officers who want to hear your story. And so we do allow we encourage, if claimants are denied, you do have the opportunity to appeal, to come in, to explain to us why you couldn't prove that you were present, but that you were, in fact were. And we will evaluate those to determine whether or not you were present. We've talked a little bit about some of this, but I wanted to just underscore it again. There are differences between our eligibility criteria and that of the health program. There's some overlap, but it's not complete. We only cover physical illnesses. The health program covers both physical and psychological illnesses. Our presence is south of Canal Street, Manhattan only. Theirs is broader, goes north to Houston, and includes parts of Brooklyn. Our time period is different. We go to May 30th, 2002. They go to July. And our exposure requirement is different. In order to be certified through the health program, you have to demonstrate that you were present for certain periods of time, depending on what you were doing. For the VCF, you just have to have been there. We don't have any timing requirement associated with how long you were there. So as Dr. Reibman said, it is possible that you can be certified for treatment through the health program, but not be eligible for a claim with the VCF, because our requirements are a little narrower than theirs are. I'm going to skip lawsuits, VCF 1, and authorizations, and just jump for the sake of time, and just jump to compensation. Could you skip ahead to the slide that says, to the slide after the one that says compensation? There we go. So our program, the VCF operates in 2 phases. First, we determine whether you're eligible. And then if you are eligible, we determine what amount of compensation you're entitled to. So I wanted to talk a little bit about how we think about compensation and what we compensate for. Compensation in the VCF has 3 components. There's non-economic loss, which is what we call our pain and suffering award. There's economic loss, which is a loss of earnings or employment benefits because you can no longer work as a result of your 9/11 related condition. There's what we call replacement services loss, and we'll talk a little bit about that. And we do cover certain medical and out-of-pocket expenses, although our policy on that is a bit limited. And then there are collateral offsets. We are required by statute to subtract from your award, from the award that we determine you're entitled to, the benefits or the payments that you've received from other sources that compensated you for the same injury. So if, for example, you got a disability pension from the FDNY for your asthma and we give you an award for your asthma, we will subtract the amount of your pension payments from our award. We're required by statute to do that so that we're not double compensating someone for the same injury. So that's our basic formula. Non-economic loss plus economic loss minus collateral offsets equals your VCF award. We do evaluate each claim individually. We want to be sure that claimants are getting the losses that they in fact suffered. And so there's not a lot, we don't do cookie cutter awards. We do look at your claims individually. Some claims can be very complicated, and that can contribute to the time it takes to review a claim. But we do look at the claims on an individual basis. For non-economic loss, so I want to just go through these quickly. Non-economic losses is the pain and suffering award. The amount of that award will vary by the type, severity, and effect of the condition on daily life. It is not dictated by the number of conditions that you get certified. I know Dr. Reitman said that. I'm going to say it again. It is not dictated by the number of conditions that you get certified. Going back to the health program to get more certifications will not necessarily increase your award. What we are looking for is the collective effect of your conditions on daily life. All eligible claimants receive a non-economic loss award minus collateral offsets, the applicable offsets. So if you are found eligible in the program, and to be found eligible, proof of presence, certified condition, timely registration, plus those other things that only apply to some people. If you are found eligible in the program, you will receive a non-economic loss award minus applicable offsets. You don't have to file anything else with us. The Reauthorize the DROGA Act that was passed in 2015 does establish some caps on these awards. So as a general rule, non-cancer conditions, so these are your air digestive conditions for the most part, asthma, GERD, rhinitis, sinusitis, those awards are capped at $90,000, and we look at the severity of those conditions when we calculate the amount of the award, so the awards range between $20,000 and $90,000. Cancer conditions are capped at $250,000 by the statute. And so for a cancer condition, $250,000 is the maximum award for non-economic loss. But we do reserve the right to consider those of our claimants who unfortunately have multiple cancer conditions for a slightly higher award. We do not need medical records either to establish eligibility or to make a non-economic loss award. Medical records can help us determine whether or not your condition is severe or more severe than the ordinary one. So if you're in a condition where if you're in a position where you believe medical records would help support your claim, we do urge you to file them. And just a reminder, we do not get medical records from the health program. We only get the certifications. So that's non-economic loss. Again, everybody's eligible for non-economic loss. Everybody who's eligible gets non-economic loss. Economic loss is different. So economic loss is lost earnings because you're unable to work as a result of your condition. And the VCF will award economic loss only if you have an occupational disability determination made by a third party. So Social Security, workers' compensation, FDNY, NYPD, NYSERS, NYSLRS, pension boards, someone else had to have found you disabled occupationally so that you can no longer work as a result of your VCF eligible condition in order for us to consider non-economic loss. We also rely on private insurers. So if you have long-term disability insurance, for example, a determination by that insurer can support a claim for economic loss. We do have a very limited program that will allow people who have no access to any of those things the ability to go to the health program to get a disability evaluation. And the criteria for that are on the website if you're in that position. Our helpline can also walk you through what those criteria are. If you have a third-party disability determination for the eligible condition, then we will review whether or not you lost earnings as a result of that disability. The lost earnings calculation considers a number of factors. It considers how old you are. It considers your income. It considers what percentage of your disability is attributable to your eligible conditions as opposed to your ineligible conditions. So, for example, if you're disabled both because of asthma and because of a mental health condition, we're barred by statute from compensating for the mental health condition. So we may only compensate for part of your disability, part of your lost earnings. We also consider the date of onset. We consider employer-provided benefits. We do compensate for things like loss of pension benefits. We have presumptions that we use about loss of retirement benefits, employer-provided retirement benefits, loss of health insurance benefits, and that kind of thing. There's a lot of detail about how exactly we do this on our website in our policies and procedures documents for those of you who are interested. The two other kinds of loss that we compensate are what we call replacement services and medical expenses. So replacement services are awarded to compensate for the value of household services, taking care of the house, doing the shopping, watching the kids, that a claimant regularly performed but can no longer perform as a result of an eligible condition. And medical records are required to demonstrate that you can no longer perform these services. This is basically an alternative way for us to calculate economic loss for those who did not work full-time outside the home. So the value of your loss has to be calculated a different way because we can't rely on a salary information. And so what we do is we rely on sort of default values about how much we can compensate for the fact that you can no longer provide these sorts of services in your home. So it's typically considered as a component of loss really only in deceased claims or in claims when the claimant did not have earned income, so there's no salary history, or worked only part-time outside the home. We also compensate for medical expenses loss. We only cover documented out-of-pocket costs that are not covered either by your insurer or by the World Trade Center Health Program. So it does have to be documented for us. We have recently put a couple of limitations on this. We only consider these claims on amendment, and your VCF claims can be amended at any time if you have a new loss. We only consider these claims on amendment after you've seen what your initial award is, and we've put a threshold of $2,000 on it. Both can be lifted in appropriate cases, but we were trying to prevent a lot of time being spent on sort of very, very small claims. So the final component is collateral offsets. We are required by law to deduct from your award the benefits or the payments from other sources that compensate for the same condition. So this includes, but is not limited to, Social Security disability or survivor benefits, workers' compensation benefits, including benefits paid by the World Trade Center Volunteer Fund, pensions from FDNY, NYPD, NYSERS, et cetera, public safety officers' benefits, which are paid by a Department of Justice program that is aimed at law enforcement officers who died in the line of duty, lawsuit settlements. So if you did timely settle and dismiss your lawsuit, the settlement amount will be offset from your award. And life insurance is offset from all deceased claim awards. Note that charitable benefits are not offset, and neither is unemployment insurance. So there is some information on here about filing a claim. I think I'm going to skip most of that for now, unless there are specific questions about it, and we can come back to it.
Thank you for those very information-rich presentations. Okay, I have like at least 30 questions here, so clearly we're not going to get through those questions, and I'm going to have to prioritize based on which questions have the broadest possible relevance to survivors. And I think probably the way I'm going to proceed is I'm going to give Dr. Reibman 3 questions, and she can come to the mic and answer. And then I'll give Rupa Bhattacharya 3 questions as well.
Kimberly, she can sit at the table and speak.
If you want to do that, Joan, you're okay. So the first question, Dr. Reibman, you are very familiar with, and it has to do with how decisions were made about which conditions are 9/11 related.
So this has been a very complicated and ongoing process, really.
Okay.
Oh, just turn on the mic?
Oh, okay.
Anyway, I'm up here. this has been and it's a process, and it's an ongoing process. So, for example, very early on, the first conditions were respiratory. We understood people had lower respiratory and upper respiratory conditions. And then for some reason that we didn't understand, people were coming with complaints of acid reflux. And then under the Zadroga law, which I now have water so I can say it, the word, there's been a scientific committee that's also been developed. And so now, based on what we're seeing in the programs, based on research that comes out, based on work from the epidemiologic programs, the New York City Department of Health, for example, other conditions may get added. So, in fact, cancer was added more recently, or acute traumatic injury, which should have been there in the first place, got added. COPD got added, and there have been a number of conditions that people have asked about, but may or may not have been approved by the government to get covered. So it has to do with what we're seeing, but also what research is bringing out as well. So I hope that answered.
The second question is, are there treatments available for PTSD?
So again, I'm a pulmonologist, not a mental health expert. But we do cover mental health conditions in the program. There are treatments that are being worked on, and of course they have to sort of be individualized. So there have been, for example, studies talking about re-exposure. That's one way in which we might or might not deal with someone who has PTSD. We may do individual therapy, we may do group therapy. We may really work on helping you with other social issues that might, in fact, be making it more difficult for you to deal with your PTSD. So it's very individualized. And in our program, as well as in many of the responder programs, it may involve a complex coordination between psychiatrists and medication, psychologists, social workers, as well as help with your medical conditions.
The third question is, do I need to get all of my medical care at Bellevue, Gouverneur, or Elmhurst? Can I go to my own doctor?
So again, we will only treat covered conditions. So certainly if you have hypertension, diabetes, all of those, we can't treat those or cover them unless they are associated with your certified conditions. By that I mean, let's say, for example, you've had really, really bad asthma, you've been on a lot of prednisone, and you've developed diabetes because of that, then we can treat the diabetes. It's an associated condition. It gets very complicated. However, let's say, for example, you really don't want to make the trip to Bellevue or to Gouverneur, and you have a doctor who you like, you can go to that doctor. We just can't cover that treatment. So we can only cover treatment for certified conditions and with providers who are in the, or certified by the program. That's a little different for cancer. For cancer, again, we are not treating the cancer. We are not cancer specialists. We will work with our case managers to help cover your cancer management after the insurance is covered. And that's a different sort of process.
Okay, thank you, John. So this question was so charming, I'm going to read it out as written.
Okay.
Many law firms are reaching out to me. How do I know which one has my best interest?
So unfortunately, that's not a question I can answer. The VCF does not endorse, refer, identify any particular law firm or government entity. We can't do that. So we sort of leave it to your best judgment to do that.
Okay, I'm getting a number of questions with very serious concerns about how getting a VCF award might jeopardize other benefits. And some of the benefits that have been named are Medicaid, Section 8 housing, NYCHA, et cetera, where they count both income and assets. I know it's a complicated question, but a number of people raised this question here tonight.
Right, and unfortunately, again, it's a question I don't have a very good answer to because we're not experts in the requirements of other programs. What I can tell you is that the VCF award is, by federal law, not taxed. So it is a non-taxable award. So to the extent these other programs rely on a identification of your taxable income, the VCF award should not affect that determination. Whether or not it will affect the determination if they're looking at assets is a question really for those programs to answer.
One person asked, why are non-economic awards for non-cancers limited to 80,000 versus cancers which can exceed 250,000?
Right. So the statutory cap for non-cancer awards is $90,000. It's $90,000. We're limited on that by statute, and that's the way it is. For cancer conditions, the statutory cap is $250,000, but because of the significant number of claims that we were seeing that involved multiple cancer conditions, and because unlike most of the conditions that are covered in the non-cancer category, most of the conditions that are covered in the non-cancer category have very similar effects on your life, and that's why we're looking at them. Asthma, rhinitis, sinusitis, these are all respiratory conditions. They all affect your life in much the same way. So we apply the cap to all non-cancer conditions, no matter how, and we don't look at the number of conditions. Cancer, unfortunately, if you have breast cancer and brain cancer, those can have very diametrically different effects on your life. And so we do look at multiple cancers slightly differently and have interpreted the statute to allow us to exceed the cap for multiple cancer conditions.
I'm going to just ask one more, which is how long is the review period or process for eligible applicants? So I'm assuming this is the claim review process.
Right. So good question. I wish I had a good answer. The fact of the matter is that because our claim determinations are individualized, some of them take longer than others. So there is no standard answer that I can give about how long it will take once you've been determined eligible for your compensation claim to be decided. It also depends on whether or not we get the information we need. One of the things that we always tell our claimants, that we always tell the lawyers who file in the program, is when we make a request for missing information, and we do make many of them, please get us the information that we're asking for as soon as possible. If you have questions about what we're asking for, please call the helpline. They'll help explain it to you. The claims that take the longest are the claims for economic loss or the claims for victims who have passed away, because those claims are more complicated. There are more other benefits at play that we need to look at. There are more factors that we need to assess. There are disability determinations by third-party entities that need to be reviewed. And so those claims can take a little longer. A straight-up non-economic loss claim, I have cancer, I want my $250,000, does not actually take that long for us to process. It's just a question of waiting in line for us to get there. We have a very strict rule of taking claims in the order in which they were filed. First in, first out. And so we do take claims in the order in which they were filed. We are right now trying to catch up on a couple of stragglers of claims that were filed in 2015, but for the most part, we're looking at claims that were filed in 2016, mostly in the middle and latter part of 2016. That's about where we are. One thing I will note is that we do have a process to expedite claims for people who are terminally ill or for people who are in really dire financial straits. We do require certain kinds of documentation, but in those, and we do ask that people exercise discretion in making those requests because it means we're taking your claim out of line, but we will make that exception in an appropriate case.
Should we do, should we do one more question each, maybe? Sure. Okay. So I think really, just to make sure everybody's got this, because this is a big piece of confusion. Someone asked, and I know this was explained tonight, but may need to be reemphasized, what is the difference between the New York City disaster area, that is the geographic eligibility for the health program, and the VCF exposure zone, which is the geographic eligibility for the Victim Compensation Fund.
Right. So, so the why is, at least for us, it's dictated by statute. Congress set the border. Congress set the boundaries. So our New York City exposure zone, and sometimes I think the name should have been flipped, like theirs should be the exposure zone and ours should be the disaster area. But regardless, it's not, it's the other way around. Our New York City exposure zone is Manhattan south of Canal Street, river to river. Their New York City disaster area is south of Houston, and I think, is it a 1.5 mile radius from the World Trade Center site? So that includes parts of Brooklyn.
Okay.
And again, it was dictated by statute. At least ours was. I'm not sure about the others, but ours was dictated by statute.
Can I answer one question here, which is an important one? If I'm in both the survivor and first responder categories, can I receive mental health benefits from one program and physical benefits from the other program? And the answer is you really have to be in one program or the other. And you will get your benefits from one program or the other. As you're trying to decide which program, because many people were both survivors and also responders, again, think about what it means to you and the differences of the program. So for the responders, you do not have your insurance billed first, whereas for the survivor program, your insurance is billed first, and then we cover the difference. So these are very, very important differences to know.
I actually have a question that nobody mentioned tonight, that maybe you can just help me. My kids were 8 and 10 at the time, and my daughter, who's now in her 20s, lives in California and has some respiratory issues. How does she go about?
Right.
Do you want to talk about
Sure.
one?
So there is another program.
Can you repeat the question?
Sure.
Yeah.
The question is really, what about someone who was a child at the time who is now living outside of New York City or state, who is a survivor? And there is, I had on that slide 4 programs, and one I didn't talk about very much, which is the national program. So there is a national program that she can enroll in, and that will provide services in California as well. And I'm sorry, but you'd have to go on the website, which I didn't bring the number. I would do this. It was a.
We have a link to the national program number on our website as well.
Go, yes. Do CDC WTC, and you'll get it there.
So just quickly, if you all, these cards were on the table as you came in. If you grab one of these cards, you will have the World Trade Center Health Program helpline on one side and the address of the website that Joan was just talking about, cdc.gov/WTC. And on the other side, you will have contact information for 9/11 Environmental Action. And honestly, we can answer or find you someone who can answer many of these questions that we're not getting to tonight. So please, I mean, we have more of these, and we'll rush them outside as folks are leaving. If you haven't taken one yet, please wait a minute, we'll get you the cards, number one. Number two, the VCF helpline is willing to engage in a detailed manner with individualized questions, yes?
Yes, that's right. And in fact, you can even make an appointment with our helpline, and they will sit down with you and walk you through filing a claim form. They are they're very helpful. We try to have them be as helpful as possible.
And that number is?
1-855, I have to look, there's too many 8s and 5s. 1-855-885-1555. The website is easier to remember. It's vcf.gov, and the number is prominently displayed on the website.
Okay.
I have a daughter who's been denied certification for asthma, and the reason is that it didn't start till 5 years later.
Yes.
So
Yeah.
it's kind of weird that we can't get her the treatment that she needs because the nurse practitioner won't let us reevaluate what's real and what's not real as far as asthma is concerned.
Okay. So there's 2 issues with that, and again, it's always as I said, we have to take a detailed history. But to be certified, there are numbers of criteria. Some of those include exposure, the symptoms, and the timing of onset of the symptoms. So this is, again, because of government regulations, but this is what has been the regulations that have been determined. Now, if you are not satisfied with that and you would like to contest that, you can do that. And again, on the website, it tells you how to do that. You come back, you make the case. You can say, for example, you know, I didn't really understand. My daughter started to cough and wheeze and have bronchitis early on, but I didn't think it was asthma. Nobody called it asthma. They only called it asthma 6 years later. And so then we look at that again, and we may or may not open that up.
We did that once, and the same practitioner said no. And she won't let us move on to someone else to evaluate.
Okay, well, if you would come separately, that case should be looked at again, and we'll look at it again and see.
Yeah. So wait, I'm sorry, I'm going to have to end the evening, but I'm very happy to answer your questions outside. And again, I really want to thank Dr. Reibman and Special Master Bhattacharya very much. And I want to thank all of you. Thank you for coming. Please grab a postpaper.
You presented today. Where can I get that one? I need a copy of that.
Of what?